Things that they don't tell you about when it comes to your bone health. And yes, I'm talking about osteoporosis in women. The adult human skeleton consists of 206 bones in total. Now, at the time of birth, there are 270 bones which fused in time to make a total of 206 bones in total. How clever is that? As women, we start to lose muscle mass roughly in our 30s, and we start losing bone around the age of about 35. The reason women are at a higher risk of getting bone loss than men is because of the changes in our hormones. The hormone estrogen, as it dips and flows and fluctuates, has a direct impact on our bone density. And now we know that because estrogen is such an important hormone that it's so essential that it helps to keep our bones healthy. So after the menopause, estrogen levels fall, and this can lead to a rapid decrease in bone density. Now, women are even at a greater risk of developing osteoporosis if they have an early menopause, so primary ovarian insufficiency, and that could also mean that if they've had a hysterectomy or removal of the womb before the age of 45. We also need to put in there chemical menopause. So if you had medication that stops your ovaries from working and you were young, so in your 20s and 30s, we use that sometimes, so medications for PMDD, then that puts you into an early menopause. That can also put you at risk of developing osteoporosis. And also if you don't get periods, so eating disorders, anorexia, those sort of conditions can make you have no periods whatsoever. That can also impact your bone density. So over-exercising, too much dieting affects your ability to retain your bone density and keep your bones healthy. But the problems don't stop there for us women. If you also suffer from another hormonal condition, such as an overactive thyroid gland or an underactive thyroid gland, then that can also impact your risk or trigger off osteoporosis. This is the single most important slide that I want everyone to look at. You might want to pause the video for this because this counts for men and women as well. Now, the risk of osteoporosis or broken bones can also extend to other parts of your history. So a family history of osteoporosis, if a parental history, so mum or dad had a history of a hip fracture, if your body mass index is less than 19, so you're underweight, if you've used steroids for a long time, so either that's inhaled steroids such as for asthma, eating disorder conditions such as anorexia or bulimia, drinking heavy alcohol, so more than the 14 units recommended, smoking, if you have a history of rheumatoid arthritis, any malabsorption problems such as celiac disease or Crohn's, and medications that can sort of be used to treat breast cancer or prostate cancer or anything that impacts the hormone function, particularly that testosterone and estrogen hormone, can put you at risk of having osteoporosis, as well as long periods of inactivity, such as long-term bed rest, or those that have chronic fatigue, ME, or as we're seeing a lot now in general practice, long COVID, that they have long periods of inactivity. That can also mean that it can impact your risk of getting osteoporosis. Now, rightly so, we worry about cardiovascular disease or cancers because we need to be aware of that. But let's compare that to the rate of osteoporotic fractures. As you can see, osteoporotic fractures has an annual rate which is far higher than heart attacks, strokes, and even breast cancer. And who suffers the most from osteoporotic fractures? Women. So let me show you what happens to your bones. Imagine this is your bones. It is surrounded by muscle, ligaments, and fat. The glitter is your immune system. So that glitter that you can see in there, and that's protecting you. The sequence in this is estrogen. You shake the bottle, so you're exercising, you're looking after yourself. As you can see, your bone is full of all the good stuff. In osteoporosis, bone remodeling imbalance happens. So the process of bone remodeling is uncoupled, leading to bone loss and decreasing bone mass. The bone microarchitecture is affected, and so that also becomes impaired. The bone strength gradually decreases, and so the quality becomes compromised. And as the bone repair, so the inability to repair micro damage, that happens from daily activities, that also becomes impacted. And when you get estrogen deficiency, it can lead to secondary hyperparathyroidism and bone loss. So leaves the glitter to settle. And as you can see, this is settling, which means that your bone now is at a higher risk of getting a fracture. So by adding in HRT, we can get that estrogen moving again and add glitter back to your bones. Well, you know what I mean, not glitter. So it's not all doom and gloom. You can work out your individual risk factors by going through the list that I showed you earlier. You can do a FRAX score online. Start doing weight-bearing strengthening exercises, take vitamin D and calcium. If perimenopausal symptoms have started, HRT as a prevention for osteoporosis is needed. And also if you're in a high risk group, such as if you've got primary ovarian insufficiency, you've had young age and surgical menopause or chemical menopause. And other treatments include bisphosphonates, which can be taken as a tablet or an injection, and it increases bone density. Strontium renolate if bisphosphonates aren't suitable. Selective estrogen receptor modulators, which are similar to estrogen, help bone density. And biological agents such as denosumab, which can be taken as an injection every few months. I hope that's been helpful. And yes, you are full of glitter. I bet you didn't think that you're full of glitter. But you know what I mean. You're not really full of glitter, but you're all stars to me. Thank you.